All right, well, thank you once again for joining us for the sixth in our series of dealer nutrition education seminars, Nutritional Management of Equine Gastric Ulcer Syndrome, or abbreviated EGUS. So you'll hear that term a bit in the talk today. So I have some interesting pictures for you, and I'm sure that you have a number of customers that come in asking about this issue, and it is a big deal. If you've ever experienced heartburn or acid reflux or a burning in your chest or the feeling like you've been punched in the stomach repeatedly, although you don't recall being in a fight recently, those are some of what we feel as people when it comes to gastritis or ulcers or heartburn or things like that. It hurts. And maybe you don't feel like eating very much. Maybe you don't feel like being very active as you normally are. So it can change your day-to-day activities. Same for a horse. It can cause them to have colic-like symptoms, lose their appetite, maybe not perform very well. And one of the things that we see very commonly are changes in behavior, such as, just generally kind of cranky or not wanting to go forward or biting at their stomachs or something of that nature. So it is a big deal. And it does affect a lot of horses. We'll talk about it in a moment. So what is EGUS, or equine gastric ulcer syndrome? So ulcers in the terminal esophagus, meaning where the esophagus meets the stomach, the non-glandular stomach, the glandular stomach, and the proximal duodenum, which is the beginning of the small intestine, where the stomach and the small intestine meet. So generally in that small area is what we're referring to when we talk about EGUS. So any horse of any age and any breed is at risk. If you are dealing with a racehorse, it is fairly safe to assume that that horse has or has had an ulcer. Studies have shown that up to 93% of racehorses have been affected by EGUS. Performance horses, that number is over 60%, and in foals, especially at weaning time, up to half, because that's very stressful. And these things develop fast. They can develop in 24 to 36 hours, really, really quickly. So there has been a lot of research out there. We know that it's there. And we know that, again, most horses that are working are probably affected. So just to review your pH and your high school chemistry here, remember pH. pH runs from a scale of 1 to 14, and it's a measure of acidity or how basic a substance is. So if a pH is 1, that's a very, very strong acid. Will certainly eat through, paper or your skin. It'll burn. Whereas on the other end of the spectrum, is very basic. It's more neutral. Think of household bleach. It's very, if you touch bleach, it's almost a little bit slimy. It sort of has that property to it. Water tends to be in the middle at a pH of 7, which is more of a neutral pH. So those are sort of the extremes there. So just to give you a little point of reference there. So a strong acid is a 1, a strong base is a 14, 7 is neutral, and we have a number of things that run in between. For example, blood is about 7.4. Hand soap might be more basic at a pH of 10. So the horse's stomach is relatively small given the size of the horse. It's only about 10% of their entire digestive system, which is interesting because, well, they seem to eat all day long, but again, that's how they evolved. So eating small meals all day long, and it's important to remember that because as such, their stomach evolved to constantly be digesting. So to secrete stomach acid 24 hours a day, 7 days a week. They always had something coming in to buffer it. They were always chewing, producing saliva to help buffer the acid. Now that's different than people, for example. We typically only secrete acid when we have a meal or we know we're about to eat. So a little bit of a difference there. But today, sometimes we keep our horses in stalls. Maybe we feed them 2 or 3 larger meals per day. Sometimes you have pasture access, sometimes you don't. But in some cases, horses may go more than several hours with no forage, and that is a very big risk for the development of ulcers. And again, we'll talk more on that in a little bit. So just a quick overview of the equine stomach. This is very interesting, and I think it gives you a little bit of perspective on what we're dealing with rather than just sort of an abstract idea. So on the left here, this is, just a scale model of the horse's digestive system. So circled in red is the stomach. And again, we've been through the digestive system in other talks, but you can see how small the stomach is compared to 70 feet of intestine and a 3 to 4 foot colon and a 3 to 4 foot cecum, etc., etc. So at the quote-unquote top of the stomach is this non-glandular portion. And at the bottom is the glandular portion. And the glandular portion, as you may have guessed, that's where a lot of this acid is being secreted from. And it has the tendency to splash up. It's separated by this distinct line here, which we'll see in another picture, called the margo plicatus. That's just for your own knowledge here. So again, that capacity is relatively small, anywhere from about 8 to 17 quarts or 2 to 4 gallons, depending on the size of the animal. And of course, it's going to vary by the size of the horse. So this is just another picture of that non-glandular mucosal layer. Here's that margo plicatus and the glandular section at the bottom. This is what the inside of a healthy stomach looks like. And again, this is just a little bit closer up here. So a fairly distinct line between non-glandular and glandular. And you'll also note the pH difference here. At the top, the pH is more 5 to 7 in that non-glandular area. So again, a little more towards the neutral side, whereas where the acid is being secreted, you're down to a 1 or a 2. So again, a very strong acid here. Now, when you have a stomach with ulcers, it's not so smooth looking. This is what ulcers look like along the margo plicatus, and this is a very common area for these ulcers to develop. So again, this is that non-glandular area at top, the glandular area at the bottom, and some pretty nasty ulcers right here. Now, I happen to know this mare, and she actually never even showed signs of ulcers. She never stopped eating. She never colicked. She wasn't ridden, but she never complained about it. So it's just interesting. But you can just see, imagine if you had a lesion like that on the outside of your skin, you would see how that would be quite sore. Now imagine that's inside your stomach. So again, that upper portion of the stomach is lined with those squamous cells and mucus to help protect it from acid that's being produced by the glandular area. And again, in the lower portion, ulcers that occur in the lower portion, the glandular portion of the stomach, are more often caused by NSAIDs. These are things like bute or Banamine. When horses are on those things long term, that's where those glandular ulcers tend to develop. Non-glandular ulcers often happen from stress, from exercise, from lack of forage, things like that. So there are different causes for those depending on where they are, but in the end, they do have some similar effects. So again, when it comes to prevalence of ulcers, most of them, this is just a schematic of where they tend to occur. So again, most of them tend to occur along that line, 64% up here, maybe 25% down here, and then less so in the glandular portion. But again, more common where the stomach meets that small intestine when you have a glandular ulcer situation. And that was based on some survey results done a few years ago. So again, what causes ulcers? As I mentioned, the etiology for the non-glandular and the glandular ulcers might be a little bit different. So for that smooth mucosal layer, usually when that protective layer becomes damaged by acid, that's when the ulcers can go right in and, well, not go right in, but you understand, they can form there once those cells have been damaged. So prevention relies really on limiting exposure to acid, which can be a bit of a challenge. Again, on the other side, the glandular ulcers towards the bottom portion of the stomach are thought to be from impaired mucosal defense mechanisms and long-term use of those NSAIDs like bute and Banamine. That doesn't mean that if one gives their horse a bute after a horse show that they're going to develop an ulcer. It's when they're on long-term treatment typically. So a veterinarian can guide that. So risk factors, again, exercise, stress, lack of forage, lack of having something in the belly, high starch intakes, insufficient water intake, confinement, lack of movement. Again, there are a number of reasons for any of these things. If a horse is on stall rest for an injury, again, that can up their stress level. That can be a risk factor. And again, the glandular ulcers could be a combination of the NSAID use, insufficient water intake, things of that nature. So I did just want to talk a little more about NSAIDs for a moment. Again, very common. You'll find them in pretty much any barn out there. Most commonly, bute or Banamine or flunixin-meglumine, the generic version. They're very common anti-inflammatories out there, very common. And So treating with both of them is very risky. So this is getting into a little more of the medical side, where a veterinarian would be the best resource as to how to dose and treat these things. But when it comes to using these things with respect to ulcers, the data is a little bit limited, especially with regard to dose. So best bet is to refer to a veterinarian when it comes to this, especially if you have a customer that comes in and says their horse is on bute or on Banamine or something like this. They definitely need to involve their vet. We can help them with the nutrition side of it, but the vet can help them with the drug side. So poor appetite is a telltale sign that an ulcer may be the culprit. If a horse leaves a little bit of their grain when they're normally a very good eater, that's always a warning sign. Changes in performance, colic, anytime a girth or a cinch is tightened, if they fuss, assuming that the girth isn't being tightened very suddenly and very abruptly, weight loss, abdominal pain. Sometimes they'll stretch out their legs to urinate or they'll bite their sides. Cribbing has been listed as a sign, but it's very non-specific, and not all horses that crib have ulcers. So it's just something to keep at the back of your mind. And again, is that full going through weaning? Is that adults on a show schedule? You know, all these things you can kind of put together in your mind to think maybe this is a risk factor here. Now, the only true way to diagnose an ulcer is with an endoscopy. So even if you yourself have ever been to a gastroenterologist for an upper GI where they've looked in your stomach, essentially it's the same thing. Only, horse, obviously you need a 3-meter endoscope and a veterinarian. So it's very specialized equipment. Not all veterinarians have this equipment available. It is a standing procedure with the horse under sedation, but they just put a camera right into the stomach and they take a look around to see what's going on. Again, it is not the least expensive procedure out there, so many people opt simply to treat rather than to do the endoscopy, but again, that's between them and their veterinarian. So what about exercise? We talked a little bit about the stomach anatomy, so you see where the acid is coming in and where the protective area is. When a horse begins to exercise, that stomach contracts a little bit. So with the increased pressure in the abdomen, and the volume of the stomach decreases just a little bit. So one theory is that all that acid's got to go somewhere, and if it's the stomach is contracting, it's probably being pushed and splashed up a little bit. Gastric pH also decreases fairly fast. So even if on the higher end you're a little bit around a 3 or a 4, when walking starts, as soon as that horse begins to pick up the pace to a trot, to a canter, the pH actually drops. Now when the horse returns to a walk, the pH will rise again. So it seems that they've seen some less dramatic change in horses that have been fed prior to exercise. And I'm not talking about a grain meal. I'm talking about having had some forage available to them. So horses that had free choice Timothy hay for 24 hours, their average gastric pH was about 3.1. Horses that were fasted, they were way down to a 1.5. Now that may not seem like a big difference, but if you took an acid of a pH of 1.5 and a pH with a 3, trust me, it makes a big difference. Horses that were grazing were generally at lower risk. It doesn't mean they're at no risk, but definitely lower because they're generally continuing to chew and produce saliva and swallow, and that definitely helps. Their stomach acid pH tends to be closer to around 4 most of the day. Now again, these are very often one-off studies. There's much more that we need to look into, but this is what we know so far. So typically an ulcer supplement, or there are a number of them out there, they're short-lived and they're not going to work long-term. Your best bet is to have that horse have a little bit of forage in his tummy before you go riding. So hence the question, do you feed an ulcer? Well, it depends. It always depends. High starch and grain diets have been associated with a higher risk of gastric ulcers. The increased risk was greatest for those non-glandular ulcers. Remember, with a lot of starch and sugar coming into the diet, there are some lactic acid producing bacteria that can produce more acid, thus lowering the pH. There may be some increased volatile fatty acid production in the stomach. A couple of studies have shown that. again, causing that bacterial fermentation to produce a little more acid than maybe you want in an already acid stomach. Cereal grains are lower in calcium. So by cereal grains, I mean corn, oat, barley. They have very few minerals, and calcium is a really good buffer for stomach acid. So if a horse has a high grain meal, it's not going to be a great buffer for the stomach. But forage definitely can be. It'll increase the amount of time the horses chew, the number of times they chew compared to grain for sure. They'll produce more saliva, more buffering activity, and the forage type may make a difference. Now, of course, the type of forage the horse is on is going to depend on that horse's needs, but alfalfa hay was shown in a study to increase gastric pH compared to brome grass or coastal Bermuda. And again, that's potentially due to the calcium content of alfalfa. It tends to be higher than grass hays. Remember, calcium's a buffer. If a horse only had straw, it actually increased the likelihood of ulcers. So that's some pretty poor quality forage for a horse. And it was speculated that because of those poor nutrient qualities, the very rough, sharp texture of the straw did not help that situation. So alfalfa is great for buffering ulcers. If a horse can't have alfalfa, grass hay will certainly work better, and you never want to feed straw. Typically not a good thing. So forage is key if you haven't gotten that point quite yet. 70 to 75% or more of the diet is great to help maintain that normal pH balance in the stomach, and it should be of good quality. Any pasture access can certainly help. That foraging behavior can help decrease gastric pH. I know we don't all have that. And allowing a horse turnout. So as much turnout as possible, even if it's in a small space, allowing them to move around is good. And if there is no pasture, allowing that horse to have hay in front of them, even if it's with a small hold hay net, anything to prolong the amount of time it takes them to chew that hay will be helpful. So a lot of these horses with ulcers are performance horses. And in a lot of cases, hay alone is not going to cut it when it comes to their energy needs. So that's when we have to think about what grain concentrates are appropriate for these animals. Are they in heavy work? Are they hard keepers? Well, we have, of course, low starch varieties. Now, how low is low? Well, that's the ultimate question. As an industry, we tend to agree that below 20% is low. When you're talking about certain metabolic conditions, that number is even lower than that. But when we're talking about ulcers, sometimes that below 20% range or right around that 20% mark is about where we want to be. Fat is an excellent energy source. It doesn't aggravate ulcers. It doesn't have that same fermentation quality that starch does. So fat is really great for helping to slow some of the movement of food through the digestive tract a little bit, to help buffer it a little more. And then, of course, feeding multiple small meals per day. 3 times per day if a horse is on a grain meal, 4 to 6 hours apart. You don't want to go any more than 6 hours apart. That's the maximum before you start running into some other risk factors for the tummy being empty too long. Protein has been suggested to be an acid buffer. Good quality protein, that is, contains essential amino acids. So higher protein feeds, for example, Cadence Ultra is our 14% protein concentrate that's designed for a performance horse. Generally seeing that controlled starch level that is appropriate for a horse with this tummy condition. Even, of course, Equate always is one of our go-tos for this. Proteins carry a charge. They can be positive or negative, depending on the environment, but they can potentially buffer that acid. So it's definitely a tool in the kit for ulcer management. Adding fats may increase PGE1, which is prostaglandin E1. Safe to say it decreases hydrochloric acid. That's the bottom line. However, corn oil that was given to ponies actually stimulated something called pentagastrin, which ended up decreasing hydrochloric acid. So you don't need to know like all the details of that. Just basically the end result was supplementing fat helped to decrease hydrochloric acid. What about other fat supplements? Likely they have very similar effects, hence something like your Ultimate Finish. But obviously more research is certainly needed because this is very promising. But fat supplements can be very good in helping these horses with their calorie needs. Water access goes without saying. We all know that's horse management 101. It should be fresh and clean. There should be plenty of it, plenty for all of the horses in a herd. Potentially it dilutes gastric fluid. That's a question mark, but it is certainly going to be helpful. Horses that don't have enough water are more likely to have equine gastric ulcer syndrome, especially this time of year, again, when it's been so hot in our area. What about the timing of a meal when it comes to competition? Does that make a difference? And it can, especially if you have a performance horse that's on a grain meal. It's been suggested to feed that grain meal 5 to 7 hours before a competition. This will allow glucose and insulin to kind of come back to normal. It is okay to withhold a morning meal if you have an early competition. Lots of us go to horse shows and leave the barn at 4:30 in the morning, and they're probably not feeding then, and you don't want to feed them right before they go on a horse trail anyway. But they always have hay in front of them. Hay on the trailer, hay in the stall. Those are always good things. And then that horse can have their grain after the competition is over, and they're cooled and ready to eat. So as I alluded to earlier, forage is advisable before exercise. Now, if the horse is coming out of the paddock and had pasture, been eating pasture all day, you're probably okay. But if your horse doesn't have access to grass, let him be in the stall or tack him up in the stall while he eats a little bit of hay. Just a small amount, a pound or so, can help sort of create a mat over the acidic fluids in the stomach, which will help lessen the splashing of acid onto that sensitive upper portion of the stomach. Is it a cure? No. Is it a management tool? Yes. So it is something that I recommend to people frequently. Now, in racehorses, it's common to restrict hay before a race to decrease gut fill and lower the weight. Now, is this bad for ulcers? That's a question mark. Probably it's not ideal, but a small forage meal is not likely to affect performance in a major way. So even if they have a little bit, again, just a pound or a half a kilogram, it may help their tummies a little bit. And when it comes to throughout the day, if you have a horse on a restricted diet, 1% of body weight in forage is really the bottom limit. That's really restrictive. And there's some other research that even recommends not going below 1.2% body weight. So it's a consideration for horses that need to lose weight as well. They still need that forage in there. Now, what about some supplements and ulcers? So electrolytes, I put up our Performin went up there. They can be, if they're hypertonic, meaning they're more concentrated in electrolytes than the sweat is, they can actually irritate an ulcer if you're feeding them directly. If they're mixed in feed or if they're mixed with water, a risk was not seen. A change in risk or an irritation of the ulcer was not seen. But especially if you're feeding a dehydrated horse, you don't want to just hit them with a huge dose of electrolytes, because not only can you irritate an ulcer, but you can also throw off some water balance and make it worse. So mixing in feed, mixing with water, definitely a better bet with electrolytes and a horse that has ulcers. So there is some limited data on that. We obviously need more research, but electrolytes mixed in feed has been deemed a fairly safe way to offer them. I've been feeding my horse Performin Win all week because of the heat and the humidity here. Other things, sucralfate, bismuth subsalicylate, like Pepto-Bismol. I'm sure you've all seen that pink stuff. Does it bind to ulcers, promote healing? Maybe, again, helpful for management, but used alone, it is not an effective treatment. Part of a management regimen, sure, but it will not cure an ulcer. Other supplements. A lot of things, for example, one of our competitors, Purina Outlast, they use these alkaline earth metals, calcium and magnesium. So if you have Tums in your closet, your medicine cabinet, and you look at them, these are some of the ingredients in it. They are often used as acid buffers, but the catch is they don't last very long. The effects are very short-lived. So again, it's not going to cure an ulcer. Will it help? Potentially. It may help to mitigate how severe the ulcers get, but it will not cure. It will not cure at all. So again, part of a management tool. So Dr. Andrews wrote a big review last year, and one of the things he talked about is the use of zinc in ulcers. So zinc is similar to magnesium, which is often used as a calming supplement and as an ulcer supplement. And it has been known to have healing properties for epithelial tissue. Epithelial tissue is, of course, part of that upper stomach lining. It helps protect from free radical damage, and Dr. Andrews had talked about some studies that looked at horses that were supplemented with zinc that actually had some lowered ulcer scores. Again, so ulcer severities are typically scored from 0 to 3. 0 meaning no ulcers, 3 meaning really severe bleeding ulcers. Zinc may help protect the integrity of the gastric mucosa. It may signal those tissues to heal themselves. Again, a question mark. It may mitigate severity, but it alone will not cure an ulcer. Those antacid supplements that I mentioned earlier, are they practical? It depends. I've fed my horse Tums before. He likes them. Is it helping? I don't know. Doesn't seem to be hurting. But they do require frequent dosing. And some of these antacids that have been marketed to horse owners have not been tested in exercising animals. They've been tested in standing horses. Now remember, I said earlier, when a horse begins to exercise, that stomach contracts and the pH drops. So do they have the same effect in horses that are exercising as when they're just standing there? Who knows? But again, with these things, you usually need a fairly large amount, fairly frequent dosing, and again, the effects are very short-lived. Other things like chia seed or flaxseed, these have come into fashion quite a bit for people trying to help buffer help heal their horses' ulcers. And chia seeds, if you ever eat chia seeds or flaxseed, if you put them in yogurt or if you make chia seed pudding or something like that, once they soak up the moisture, they form, and I hate this word, but they form a mucilage, which it's like a thick, not pasty isn't the right word, but you can see in the picture, it forms this sort of thick substance. And there is some evidence that this mucilage will help to coat an ulcer and potentially protect or help protect that damaged tissue from getting worse. Once again, it may be one of those things that helps facilitate healing, but it alone is not a cure. And then again, what is the proper dose? How much chia seed, how much flaxseed do you give to really have an effect? That question remains unanswered. Other things, aloe vera. There's one study out there in horses. It had a fairly flawed design. It didn't heal ulcers. Papaya contains something called papain. There are a number of papaya supplements out there marketed to horses. Papaya or papain is sometimes used for wound healing. Hence, people think, well, maybe this will be useful in horses. Some people take it for their own gastritis. Again, no evidence that it actually works in managing EGIS, but there are some people who swear it helps their horse. So in these cases, I say to people, if you think it's working for your horse, then go with it, because these kinds of things are not going to be harmful. Sea buckthorn berries, there are a couple of supplements out there that contain this. Again, they may stop ulcers from worsening. There's only 1 or 2 studies that looked into that. Again, will not cure. There are pectin lecithin complexes out there, a couple of studies on that. One that showed it prevented ulcers from getting worse. Another showed, however, it did not prevent ulcers. Pectin is a gelling agent. Lecithin is an emulsifier. So again, going with that theory that maybe coating the stomach or the ulcer may be helping here, but obviously more research is needed. Is there a cure? The answer is yes. There is one FDA-approved cure for ulcers in horses, and that is omeprazole. So this is GastroGuard. That's the prescription strength. UlcerGuard is the over-the-counter. A number of you probably carry this in your stores. It is essentially the same drug that you would take if you went to the pharmacy and got Nexium or something like that. It's not exactly the same form in horses and humans, but the premise is the same. It's called a proton pump inhibitor. So what it does is it shuts off the production and secretion of hydrochloric acid. So it is the only FDA-approved cure. It does cure, proven repeatedly that it works. The downside is that it is expensive. If you have ever treated a horse for ulcers, and I have, be prepared to take out that credit card. It is not cheap. However, it is worth it because it does work. There are a number of compounded forms out there. They tend to be not effective. They don't work. They tend to break down in the stomach. So there are people out there that feed it, but they're really not doing very much with it. The human form also does not appear to be effective in horses. There's a slight chemical difference in what the horses get versus what the person does, even though the effect is the same and the drug is called the same thing. So, but yeah, this really does work for horses. Can you feed it forever? Well, hopefully, for your wallet's sake, you don't have to. But what about the long-term use in horses? In people, if you keep up with the news at all, there were some studies that said there's a potential risk of some altered mineral digestion that affected bone health in people, specifically calcium, potentially causing people to have more risk of bone fractures. And some potential risk of increased gastrointestinal infections. Is it the same in horses? We do not know. Digestive processes may be affected in adults or foals. Is there a difference? Is there a change in the normal gut barrier function against bad bacteria? These are all questions that remain to be answered. So obviously, when it comes to this is really for your information. Working with a veterinarian is essential for the medical management of ulcers, but obviously we can help you with the nutrition side of it. But it really is a strategy, and it really is a management plan for helping to manage horses with ulcers. And there's more of them out there than you may realize. So in summary, management is very key. Having free access to forage, hay nets, those small hold hay nets. If you have customers that come into your stores with, again, horses that either need to lose weight or have metabolic concerns or have ulcers, stock some of those small hold hay nets. They're about 3 or 3.5 centimeters around. I mean, they're little, but they will help extend that chew time for hay. Making sure, basic things. There's plenty of water. Minimizing stress. Well, what is stress? What stresses one horse out may not stress another one. And it could be anything with herd dynamics, amount of turnout, backing down on exercise. Instead of training hard 6 days a week, maybe you train hard 4 days a week and do a lighter workout the other 2 days. Low starch diets, things like Safe and Easy Performance, Equate Gut Health, Cadence Ultra. These are all types of diets that are recommended for horses that need calories but can't have a lot of starch. So that vet is a key player for the medical management, the diagnosis, and the recommendation of whether that customer should be giving their horse omeprazole or not. And then the nutritionist, like Kristen or me, we can help you with the dietary management of that. And again, everybody's situation is going to be different, so we can work with some of those factors and create a plan that works for each customer and each horse, most importantly. So that's it. Thank you again for your time and your participation. And if you have any questions, please feel free to send them our way. Again, I will be posting this recording on YouTube, and I will send you out the link.